That was the first thing he said as he sat down for the checkup. A 72-year-old man-fit with no serious pre-existing conditions had just walked in from the parking lot. No shortness of breath, no sweating. It's not sharp or stabbing. Just feels like something's stuck. Right here, he said, pointing to the center of his chest. We ran an EKG immediately. By the 4th minute, it showed an irregular rhythm. By the 9th minute, the ambulance had arrived. By the 27th minute, he was on the table getting a stent placed to save his heart. He lived, but many others don't. Chest pain, it sounds simple. But after the age of 60, it's one of the most deceptive early signs of a heart attack. It can hit like a crushing pain or sneak in. Quietly, like a gentle tap on the shoulder. Some people say it feels like there's pressure on their chest. Others just feel a bit bloated after a meal. And that's why I'm writing this. Not to scare you, but to help you recognize chest pain for what it really is, before it becomes the last message your heart ever sends. Chest pain doesn't always mean it's coming from your heart. It could be stomach-related, lung-related muscle strain, or even just bad sleeping posture. But here's the scary part: if it is heart attack pain, you only have minutes to act. Medically speaking, chest pain refers to any sensation of discomfort. Pressure or tightness in the area between your lower jaw and upper abdomen, most often centered around the breastbone. It can be dull or intense, come in waves, or linger constantly. So what makes chest pain dangerous? Because sometimes it's the first and only warning sign of a heart attack. This happens when the coronary arteries become blocked, preventing the heart from receiving enough blood and oxygen. Without emergency treatment during the golden hour, within 90 minutes, heart tissue begins to die, leading to heart failure, arrhythmias, or even death. What's worse is that in older adults, heart attack symptoms often don't follow the classic pattern. No intense chest pain. No radiating pain down the left arm. Just mild bloating. Shoulder fatigue or lightheadedness. According to the American Heart Association, up to 40% of people over age 65 experience a heart attack without even knowing their heart is in trouble until it's too late. That's why even mild chest pain should be taken seriously, especially if you have a history of diabetes, high blood pressure, or elevated cholesterol. One reason many seniors downplay chest pain is because they felt it before, yet nothing happened. They assume it's probably just indigestion, a pinched nerve, or maybe stress. But that kind of thinking causes them to miss the crucial window when the pain is actually a signal from the heart. The truth is, not all chest pain comes from the heart. For instance, people with acid reflux GERD often experience tightness or burning in the chest after meals, sometimes with sour burps. The pain may worsen when lying down or bending over. Meanwhile, pleurisy or pneumonia can cause sharp pain that gets worse when you breathe deeply, cough, or change positions. If the pain is localized and worsens when pressed, it might be a pulled muscle or inflamed nerve in the chest. And if the pain comes with a racing heart, shaking hands, and a feeling of suffocation, it could just be a panic attack. The problem is, many heart attacks can mimic all of the above. That's why no one should self-diagnose. If you're experiencing unusual chest pain, especially if it's accompanied by nausea, dizziness, or cold sweats, let a doctor decide. Because it's always better to suspect the heart first than to regret it later. One-center chest pain, like someone sitting on your chest. This is the classic type of chest pain when the heart is in distress. The pain strikes right in the center of the chest behind the breastbone. Feeling like intense pressure, heaviness, or tightness. It may radiate to the left arm, jaw, or back. Some people describe it as like someone sitting on my chest. Unlike muscle strain or indigestion, this kind of pain doesn't change with movement lying down or pressing on the area. It may come with cold sweats, shortness of breath, nausea, or a vague sense of fear. If this chest pain lasts more than 510 minutes and doesn't ease with rest or medication, call emergency services immediately. It could be a heart attack, and the sooner the intervention, the less damage your heart will suffer. 2. Sharp pain on one side of the chest. Quick stabbing like a needle prick. You feel a sharp stabbing pain, like a needle at one clearly defined spot, often on the left or right side of the chest. The pain worsens when you take a deep breath, twist your body, or press on that area. It usually lasts just a few seconds to a few minutes, then disappears. This is typically caused by chest muscle strain, inflamed intercostal nerves, or chest wall spasms not related to the heart. It may occur after lifting something heavy, sleeping on one side too long, or from poor posture. However, if the sharp pain happens at rest and comes with sudden shortness of breath, dizziness, or a racing heart, it could be a sign of pulmonary embolism, a serious condition that needs urgent medical care. Don't guess. If you experience sharp chest pain, frequently get it checked out. 3. Pain radiating to the jaw or right arm when the heart pretends to hurt elsewhere. The heart doesn't always signal pain directly from the chest. In older adults, especially women, a heart attack may begin with discomfort in the lower jaw neck or even the right arm. It can feel like muscle soreness, numbness, a dull toothache, or an ache in the shoulder blade. Because these areas aren't near the chest, many people mistake the pain for arthritis nerve inflammation or dental problems. But this is actually a sign of an atypical heart attack where the pain signals from the heart are misrouted to nearby regions due to shared nerve pathways. If you feel dull pain numbness in your arm or unexplained jaw discomfort, especially along with fatigue, rapid heartbeat, or nausea, think about your heart first. This is especially important if you're over 60 or have underlying health conditions. 4. Right side chest pain doesn't seem like the heart, but don't ignore it. When pain shows up on the right side of the chest, many people automatically rule out the heart. They assume it's the liver, gallbladder, lungs, or just a pulled muscle, and often that's true. But not always. Right chest pain can be caused by gallbladder inflammation, reflux, or muscle strain. However, in some older adults, especially those with a history of heart attack, the pain may appear on the right side if the blockage affects the right coronary artery. So if you're feeling tightness or discomfort in the right side of your chest, along with unexplained shortness of breath, sudden fatigue, or a racing heart, don't just assume it's liver heat or weak digestion. Let a doctor check your heart first to rule out the serious stuff before considering the less dangerous causes. 5. Dull pain below the chest feels like indigestion, but it's the heart. This pain isn't centered in the chest, and it's not sharp hits, more of a dull, tight feeling in the upper abdomen, often appearing after meals or when lying down. Older adults frequently mistake it for bloating indigestion, or stomach issues. They take digestive enzymes, feel a bit better, and brush it off. But this is actually one of the atypical heart attack symptoms, especially common in people over 60 women or those with diabetes. The pain may come with mild nausea, dizziness, or unusual fatigue without any obvious chest discomfort. If you feel persistent discomfort below your chest, lasting more than 15 minutes even while resting, don't assume it's just a digestive problem. Your heart may be in distress, it's just speaking in a way that's easy to misunderstand. When should you call a 911? Not all chest pain requires a 911 call. But if you notice any of the following, don't wait, treat it as an emergency. First, if the pain lasts longer than 5 or 10 minutes doesn't improve with rest and doesn't change when you move or breathe deeply, especially if it's in the center of the chest and feels like pressure, heaviness, or a squeezing sensation. Second, if the chest pain comes with shortness of breath, cold sweats, nausea, a racing heart, dizziness or lightheadedness, there's a strong chance it's heart-related and serious. Third, if you're over 60 and have a history of high blood pressure, diabetes, high cholesterol, or a previous stent placement. Don't wait for obvious signs. If something feels off, get checked right away. And remember, don't drive yourself to the hospital. Calling an ambulance gets you medical attention from the very first minute. And when it comes to your heart, every minute could save your life. Eve sat beside many elderly patients, people who looked completely fine, even healthy. They'd say, "It's just a little chest pain, doc." Probably from sleeping wrong. And then an hour later, everything changed. Chest pain isn't always a heart attack, but if it is, you won't get a second chance to make the right call. I didn't write this to scare you. I wrote it to protect you and the people you love. Because after age 60, the heart doesn't always scream when it's in trouble. It whispers. It sends quiet warnings. A dull ache, a slight pressure, just enough to feel off, but not enough to send you to the doctor. If any of the situations above sound familiar, don't wait for the signs to get clearer. And if you found this helpful, comment 1. If there's something I can do better, comment 0, so I know what to improve. I'm here for the long haul, not just once, but for every heartbeat you've still got left.